The Sine Institute of Policy and Politics is American University's incubator for policy innovation. We convene leaders in the academic, public, private, nonprofit, and journalism sectors to engage and promote common ground and nonpartisan solutions. In an evolving world, we seize the opportunity to work on the nation's most pressing challenges through collaboration by experts and top scholars in their field with students in research and scholarship. As part of that goal, the Sine Institute leverages American University's location in our nation's capital, the nexus of government and a growing international business center. We connect diverse perspectives from around the country and around the world with our world-class academics and research, experienced practitioners, and the most politically active student body in the U.S. We stand apart through our focus on the role of business and the nonprofit community in public policy, the rise of the importance of economic regions in the United States, and international policy issues. Our focus is to make an immediate impact at the intersection of policy and politics that leads to real and lasting change. Thank you for joining us as we convene, communicate, and collaborate.
It is with great honor and privilege that I stand before you today to introduce a man of remarkable leadership, Governor Larry Hogan. Throughout his tenure as governor of Maryland, Governor Hogan has exemplified resilience, pragmatism, and unwavering dedication to serving the people of his state, particularly during times of crisis. Governor Hogan's ability to govern efficiently in moments of crisis has been truly commendable. One of the most notable examples of his leadership in the face of adversity was during the civil disarray in Baltimore. When the city was gripped by protests and unrest following the tragic death of Freddie Gray, Governor Hogan demonstrated swift and decisive action. He prioritized restoring order and ensuring the safety of all residents, while also addressing the underlying issues of injustice. Hogan's leadership shone brightly amid the unprecedented challenges brought forth by the COVID-19 pandemic. He led Maryland with a steady hand, implementing proactive measures to protect public health, support frontline workers, and mitigate the spread of the virus. Governor Hogan's approach was marked by collaboration, data-driven decision-making, and a commitment to transparency, earning him widespread praise for his handling of the crisis. In addition to his adept crisis management skills, Governor Hogan has consistently prioritized bipartisanship and cooperation to achieve meaningful results for the people of Maryland. His ability to bridge political divides and work across the aisle has been instrumental in advancing key initiatives and addressing issues facing the state. As we gather here today, let us recognize and celebrate Governor Larry Hogan's remarkable leadership in times of crisis, his dedication to serving the people of Maryland, and his enduring commitment to building a brighter future for all.
Thank you so much.
Before I begin my interruption, I would like to make it known that Amelia Chese Alvasar will not be coming today for a little while into the event, but she is on her way. It is my distinct pleasure to introduce a professional and distinguished leader in the field of marketing and communications. Please join me in welcoming Mr. Matthew Clark, the Senior Vice President of Marketing and Communications at the University of Maryland Medical Center. In his current role, Matthew oversees the University of Maryland Medical System's communications, media relations, advertising, and marketing efforts. His responsibilities extend to partnering with various teams across the system of advanced strategic planning, change management, public affairs, and policy analysis. Matthew's remarkable career is marked by a consistent record of success in both the public and private sectors, earning him a reputation as a dynamic and results-driven leader. Previously, Matthew served as the Chief of Staff to Governor Larry Hogan of Maryland from 2017 to 2020. During the first 2 years of the Hogan-Rutherford administration, he also held the position of Director of Communications. In these roles, Matthew played a vital role in executing policy and operational goals set forth by the governor. His responsibilities included overseeing cabinet activities, managing a substantial state budget exceeding $50 billion, and spearheading policy and legislation on a wide range of critical issues, from transportation to the environment to healthcare and social services. Furthermore, I'd like to introduce Christopher B. Shank. Christopher Shank Yes. I served in a variety of elected and appointed roles in the Maryland state government for 30 years. As a state legislature from 1998 to 2014, he represented Washington County in the Maryland House of Delegates and State Senate. In 2014, he joined the Hogan-Rutherford administration, serving as a deputy chief of staff, chief legislative officer, and senior advisor. As a part of his responsibilities, Chris supervised all aspects of IT policy in the executive branch of the state of Maryland, directly overseeing the Department of Information Technology. He was the governor's senior advisor on cybersecurity operations and policy, developed the state's cyber workforce, and provided senior staff oversight in all cybersecurity incidents impacting operations, supervised the state's response to major 2021 ransomware attack impacting Maryland Department of Health, and oversaw recovery and resilient projects to modernize applications impacted by the cyber attack. He also supervised an enterprise-wide cybersecurity assessment and remedy process totaling $200 million budget allocations. He also organized and supervised Governor's Cybersecurity Summit in July of 2021 and acted as the governor's designee for the National Governments Association Cybersecurity Policy Advisors Network. Please join me in welcoming Christopher B. Shank and Matthew.
Thank you for those introductions. That was really made me sound way more impressive than I am. So this is a rare honor for me. As a staffer for the governor, it's very rare that you get the opportunity to publicly ask the governor questions, right? He's usually the one standing up there telling staff what to do. So this is a unique. Yeah, it is. So we're going to start with the unrest, the Freddie Gray riots, sir. And for those who may not be familiar, can you just talk through the events of those riots and explain what happened in the first few hours and days?
Yeah, sure. First of all, thank you. I think both students did a great job on the introductions. They did make us all sound better than we really are, but thank you for putting so much work into that. And I apologize for Amelia Chasse Alcivar, who was probably going to be the star of the show here, is running late on a train, and she's hoping to join us. But I want to thank Chris Shank for filling in at the last moment. It's a little bit of a bait and switch. He's not going to be as good, but we're happy to have him. Matt, it's wonderful to be with you. And I want to give a shout out to one more person, our former director of federal affairs, and ran our Washington, D.C. office, is now the Director of Government Affairs for the National Governors Association, Tiffany Waddell. It's also in the back here. So, we're here talking about various crises. This was early on in the term. I had only been governor for 89 days. And there was a tragic death of a young man named Freddie Gray, who died in very uncertain circumstances in police custody. And it caused, tremendous concern and unrest in the city of Baltimore. We kind of anticipated some of this could become more of an issue, more violence in the streets. It was after the issue of Ferguson. It was at the very beginning of the kind of Black Lives Matter movement and people, protesting in various cities. We were 5 years earlier than things happened around the rest of the country. But we had just put our whole team together. This death happened. We could tell that there was a lot of concern and unrest in the city. It started on a Saturday night when there was a Baltimore Orioles game where there was just a little bit of an issue. They were flipped over a police car in front of the building. People were trapped inside of the ballpark and the police wouldn't let them get out. But we started to immediately make decisions and preparations for what could be a more widespread situation in Baltimore. Monday afternoon, I was on the way to the Korean ambassador's residence for a meeting when my assistant showed me an iPad in the back of a truck that showed the city on fire, police cars being overturned, massive amounts of destruction and violence. I immediately tried to get the mayor of Baltimore on the phone, and I said, Madam Mayor, we're ready to provide whatever assistance is necessary, whatever help that you need. And she said, we don't need your help. Everything's under control. And I said, well, it doesn't look like it's under control. It looks like the city's on fire. We had 400 businesses destroyed in the first few hours. 137 police and firefighters were injured, and we're at the University of Maryland Medical Center, shock trauma, where Matt is now in charge of communications and vice president. But so I had already kind of prepared. We had already put our state police denied leave after the weekend. They all had to be on standby and ready. We didn't activate the National Guard over the weekend, but we told them to be prepared to potentially activate. And so, look, there was a real frustration in the city, but it was spilling over into violent acts and destruction, and people's lives were at stake, and the people of Baltimore were being threatened. And so I was having back and forth with the mayor of Baltimore, who didn't want our help and didn't think it was a big issue, and then others crying out for us to try to help bring some peace to the city. I made the decision to declare a state of emergency immediately after the first couple of hours. I sent in, mobilized, and then sent in 4,000 members of the National Guard and 1,000 additional police officers and firefighters. And then I spent a week. We immediately stopped all the violence. And then we spent a week walking the streets of Baltimore, trying to lower the temperature and trying to listen to the citizens' concerns. And I met with people that were protesting. I met with the NAACP and community leaders, and it was a big crisis early on, and we had a whole team of people working to both lower the temperature and listen to the concerns, but also keep people safe. And
so Governor, you're touching on what I want to get into. As a communications director, the actions that you took sent an important message, a really important message. And as you said, the National Guard came in. We had state police, we had police from other states and other counties came in to support, and you were making personal calls to other leaders. But once the situation was under control, you made a different decision to start to think about the people who were caught up in the violence, right? The people of the city. Can you talk a little bit about some of the interactions that you had and some of the activities that you engaged in, and what that message you think that sent as the riots were unfolding?
well, right away, as soon as we saw what was happening, I was immediately thinking about both things. I was thinking about, I've got to make some really hard decisions that are not going to be universally popular, but my main job as governor was to keep people safe, and they weren't at the time being safe. But also I had to kind of reassure the people of Baltimore that things were going to be okay and that we were going to get back to normal and that we were going to listen to the concerns. And so after I declared a state of emergency, I went into the flaming city that night and stayed for a week and walked the streets. And I thought it was important. I was hugging shop owners whose businesses were destroyed, and I was talking with people whose homes were burned. And my first stop was at shock trauma to see the injured firefighters and police officers who were attacked. And then I went to Freddie Gray's neighborhood and walked the streets, and there were, some of his friends that were out shooting hoops on a basketball court, and I went over to talk with them and took a couple shots, which was one of the better quotes in the Washington Post. I think his story was, they said, the governor can shoot for real. Well, first time I got a compliment like that, but I thought it was important to let people see me there, and I wanted them to feel like we're going to get back to normal, and that somebody does care, and we are going to listen. So we went and met with people all across the city. We brought in all the ministers of the Black churches. We met with the NAACP. We walked the neighborhoods. We walked the streets, and we tried to just let people know that it was basically commander in chief and consoler in chief, and trying to lower the temperature and bring people back together.
So they're showing some images now, and it's bringing back a lot of strong memories. But anything that really stand out for me, that story you told about shooting hoops. I remember we were walking along and we had a ton of state troopers with us, and you just saw some kids playing ball, and you went over, and the communications director and me was like, "Geez, don't let him shoot." Like, I don't know what a shot is like. But any of those sort of human moments that when you think back, are particularly vivid or particularly remarkable for you?
I mean, that was, going to Freddie Gray's neighborhood and talking to his neighbors. And I remember that there were a couple of guys just out there, playing basketball. And I don't think my state troopers or communications guys thought it was a good idea, but I just like, hey, throw me the ball. And I took a shot. Frankly, I actually didn't sink the 3-pointer, but they liked my form anyway. And they said, they could tell I knew how to play basketball. But I was walking the shops, and I remember a couple of the shop owners that were, their whole lives were destroyed. They didn't really have insurance, and they lost everything. And I was helping sweep up the broken glass, and I was just trying to console people and let them know it was going to be okay. There were a lot of people in tears, and then there were people that were angry and frustrated and had concerns about social justice and the police department. I tried to listen and talk to them, but there were literally hundreds of these kinds of moments for a solid week. And then this picture here, I went over repeatedly to thank every firefighter and police officer and National Guard soldier as well. So I was talking to the people that were upset, the people that were concerned that their neighbors weren't safe, the protesters. We even had some discussions with gang members. And thanking the folks that had uprooted their lives to spend a week trying to keep people safe in Baltimore.
So to get more directly into some of the communications choices that that you made, a moment like this, there was national media all over the city. So all of the networks were there. International media. I remember we were getting calls from Germany and the BBC and every place else. And for a governor of a state like Maryland, that's a remarkable opportunity to have that much attention put on you, and it's a chance for you to get your message out. But you made a decision about how we were going to handle media that was unique, and certainly not something I've seen in other places. Can you talk a little bit about the choices you made with respect to how we were going to engage with the media over the course of that week?
Well, I really thought that, leading in the crisis was more important than talking about it. I did think communicating was important, but I was talking to people in Baltimore City, and it was okay if the media wanted to come and watch. But I turned down, I don't know how many, 100 national media interviews, because I'm not coming to a studio. We're in the middle of trying to stop the crisis. If you want to talk to me, this is where I am. I'm on North Avenue, walking and talking to people. But I thought it was important to communicate to the people of Baltimore things were going to be okay, but I didn't think it was that important to go on national TV. And so I literally didn't do very many interviews at all unless they showed up where I was. I know there was one early on in the process where the team, and maybe Matt was part of that discussion, trying to convince me I should go meet CNN at downtown. I was coming from shock trauma on the way to meet with the National Guard to talk about the response. And that was the one time I made the mistake of listening to that advice. And I stopped, and Don Lemon was doing an interview on the streets, and the mayor of Baltimore also was there. Neither one of us knew the other was going to be there. And Don Lemon kept asking the same questions over and over again, trying to create a rift between me and the mayor. And what about this? And aren't you taking over? And the problem? And I was like, the city's on fire, and I've got things to do. So basically, at the end of after 5 or 6 questions, both the mayor and I both pulled out our microphones and just walked off the set on live TV on CNN. Like, we don't have time to listen to this nonsense. We've got work to do. But that was the last time. I think then I told CNN I wasn't doing any more interviews for the rest of the week.
Yeah, that was a policy person who advised that. Yeah, that was a former senator or something like that. So I just want to make sure we're good on time. I'll ask one more question, and then I think we open it up for some questions. So after that, I recall getting, I know we're going to talk a little more about COVID later and how you interacted with governors around the country during COVID, but even after the Freddie Gray riots, I got a lot of calls from other governor's office, mayor's office, asking, what went through your head. We're worried about this crisis. We're worried about that crisis, and tried to give them advice, even though every situation is different. But what kind of interactions did you have with other governors or other leaders who were sort of facing these kinds of challenges? Because they're not uncommon when you're leading any state in the country.
Well, we were getting a lot of questions from other governors. I was really involved in the National Governors Association. They, in fact, asked me I taught a course for the other governors about how to deal with a crisis like that. I'm not sure that many of them took good notes or paid much attention to it, because in 2020, when we had these kinds of problems in major cities all across the country, it seemed like there were mistakes being made all over the place, like not stopping the violence or letting things continue to go for a month and people weren't safe, or overreaction or this and that. And I think we got it about right. And my advice was, your main job is to keep people safe and allow for the peaceful protests and to make sure people know that you care and to take quick actions. And most of them didn't take actions and didn't make decisions. And so, but yeah, they were all asking for the advice and I gave it to them, but I'm not sure they all listened.
So, Chris, do we go to
Yeah.
student questions?
I think we have some of our associates that are going to do some questions.
Got some questions in the audience? Is there a microphone for the? Yes. This young lady looks like a student, but she actually is on our team. So this is Emma.
All right, so we put together a couple questions from our student associate group. But the first one, was there ever a time during a crisis that you needed to take a different or unique path to get something good? Done?
During the crisis that I had to what?
You kind of had to take a different or unique path to get something done, kind of not going down the more traditional path.
I don't think any of it was really traditional. I mean, it's not something that we ever imagined having to do. And it wasn't part of the plan, right? I mean, we didn't expect this kind of a problem to occur. And I can't think of a thing that I had to take a different path. You have to make quick decisions. And whether they were right or wrong, I think one of the biggest problems you can do in a crisis is not making a decision. And, but I'm sure we did some things that we could have done better, but for the most part, I'm very proud of the response from our team in the governor's office and the communications and all the law enforcement and the people in the National Guard. I mean, I think it turned out about as good as it could. And then in 2020, when there were disturbances and protests all around the country, some of which got pretty bad, Baltimore was relatively peaceful because the people of Baltimore actually worked with us to keep things under wraps. And so I'm proud of the response. Any other questions?
Yeah, I'm curious how you think your dynamic, like within your team, sort of changes when you're going through a crisis, because it's definitely not the same. Like when it's sort of run of the mill,
Yeah.
everything's normal. So when you're going through these crisis like Freddie Gray, like how does the team dynamic change?
Well, that's a really good question. I'm not sure that it changes that much, but different people have more of an emphasis, right? Depending on what the subject matter is. But the most important thing I can say is that surrounding yourself with the best, smartest people you can and listening to their advice. And so we would get input from everybody, like the security forces. Luckily I appointed a really good superintendent of state police and the first African-American female general, adjutant general of the National Guard in America, which helped enormously in the riots in Baltimore because it was the face of the National Guard, looked different, and she was a tremendous leader. But yeah, I think I always took a collaborative approach. I brought the smartest people in the room and gave everybody a chance to give their input, and then I would decide. And so it might be different ones that weighed in more on a particular topic. It was the same smart people that I relied on, from the chief of staff and the deputy chiefs of staff to the communications team to the security team. But that's a really good question. Depending on where the need was and what the issue was, somebody would have more of a role.
Okay, if I add something to that?
Sure.
So it is a really good question. I really appreciate it.
I've never been asked that question. Okay.
I will say, so as Governor Hogan mentioned, this was 60 days in to the administration, 89 days into the administration. And he's right. I remember sitting around the table as the city was burning and we were arguing with each other, right? We all had different views on what to do. And after the crisis was over, right? After the riots were over, it had set a tone for how we were going to work with each other as a team when the next crisis evolved. I think everybody had what they call psychological safety, right? You knew you could say what you wanted to say and get your point across. You might not get your way. Governor might decide against you. He might even tell you your idea is the worst idea you ever heard, right? But which is said to me all the time. But you knew that you were free to express yourself in a very difficult moment. And I think that set a really good tone for how we were able to deal with stuff in the future. So
that's an excellent point, Matt. Thank you for saying that. And I think that's really the key to our success was the good team. And they all knew they could tell me when I was wrong. They could all disagree. And I would listen to everybody's input. Sometimes they would still, I would override them all and still make a decision anyway. But they knew that I didn't have yes people around me. You know, they were like, Governor, we think you're crazy. Like, that's a really bad idea. And they would argue with each other. And I sometimes would be like, well, what Chris said and what Matt said, we're going to do somewhere in the middle. I would decide or add up that aggregate of what they were recommending. Right over here, Emma.
Hi, I was just wondering, like, what was the biggest takeaway from that experience from like leading in a crisis, and like, how would you bring that to if a future crisis were to happen?
Well, we dealt with a lot of crises throughout. I think we're going to talk about a few more, but for me, you know, I was a brand new governor. I had never done this before. I had never held elective office before. Our team was brand new. You know, they barely knew how to find the restroom. They were just unpacking the stuff for their desk. You know, we weren't an experienced team. They were all really smart people that done other things. But you know, I think getting all the input, making fast decisions and decisive actions, and then communicating why. Telling people this is what we're doing and here's why. And I think that will be the common theme throughout the whole 8 years. And this was like in the first couple months. One last thing I think on this topic I want to mention is I was on the way after I declared the state of emergency. She was going to head right into the Flaming City with our whole team. Governor Chris Christie called me and said, you know, my advice is tomorrow morning you ought to get up to the people of Baltimore and let them know that you're there. And I said, Chris, I'm on the way right now. And then the state troopers are driving me in a black SUV, and they said the White House is on the phone, and President Obama called. And first time the president had called me, after being governor for 89 days, and he said, you know, Governor, I just watched your press conference, and I'm very concerned that you're sending in the National Guard into the city, and I think it might inflame the situation. And you know, I'm just want to caution and find out. So, and I said, Mr. President, I really appreciate your input and concern. I can assure you the last thing I'm trying to do is inflame the situation, but I have an obligation to keep people safe, and we're going to do everything we can to show restraint and allow peaceful protests, but we're going to stop the burning and the looting and the violence. And so it was basically a lot of people were weighing in. I had to just say, you know, my team was arguing about it. I got the president telling me not to do it, but I just did what I thought was right. I didn't care what the politics of it was. Yeah, I thought it could be a white Republican governor sending the National Guard into a black Democratic city. Is president concerned? I didn't care about the outcomes. My only thing was, how do we keep Baltimore safe, and how do we bring this to a conclusion?
Right. Governor, let's fast forward the tape just a little bit now. And great discussion
Hold the
about
mic a little closer.
great discussion about the early part of the administration, but not that long after the riots and restoring order, you were faced, and the state was faced with another crisis. And this time it was a personal crisis. And you've been very public about it. Share with the group here a little bit more about how you shared to the public your diagnosis of cancer.
Right. That's a great picture here. But so if you noticed in the riot pictures, I had this full head of gray hair. I was like a TV weatherman, you know, I looked like a politician, and then all of a sudden I have a different style. But it was 60 days after the riots. We had done our first trade mission. We were going to Korea, China, and Japan, and it was a successful trip. And I normally am the Energizer Bunny, but I was feeling really run down and tired. I had some aches and pains, and but I still made it through. I was walking the Great Wall of China and I had to sit down for the first time. And my state troopers were really concerned, like, Governor, are you okay? And I was like, I don't feel so hot. But we were doing 14-hour days in a time zone that was 13 hours different. And last day I was in Japan shaving, and I felt a big lump out of my throat, like I had an Adam's apple. It seemed strange, didn't hurt. And I came back home, and right after that, I went to the doctor. Long story short, 3 doctors walked in the room and said, Governor, we have some really bad news for you. You have very advanced and aggressive cancer all over your body. We found 50 some tumors, you know, from your neck to your groin, and we have to start immediate dramatic actions. And so I was like, what do you mean? You know, I mean, quite frankly, my first thought was, how do I tell my wife and kids? And then how do I tell the people of Maryland who just, you know, elected me and put the state in my now potentially shaky hands? And so it was Friday of Father's Day weekend when I got this news. I had to go home, and my first thought was my dad, who was still alive. How am I going to tell my dad, my wife, my 3 daughters? And then I was like, how am I going to tell the people of Maryland? And I just decided early on that I was going to be as transparent as possible. And so I think just being honest and letting people know, hey, I've got a bad thing here, but I'm going to keep trying to do the best job I can. And so quick funny story. I don't want to get too long on the answer, but a Monday morning I had to do a bone marrow biopsy where they drill into your hip to core out some sample out of your bone. It's pretty painful. They put you to sleep. And I told people, I was in the thing, they're giving you the thing when you go for surgery. They say, we're going to put you to sleep. We're going to give you Percocet or Vicodin, pain medicine. You're going to be a little loopy. So don't operate any heavy machinery. I was like, if I wasn't planning on doing that, and don't drive. And I was like, well, state troopers won't let me drive anyway. They take me everywhere, and don't make any major decisions. And so I said to the doctor, well, I'm having a press conference this afternoon. And they said, that's a really bad idea. But I went out and told the people of Maryland what I was faced with. And then I continued to just share it. This picture here, I went through 24-hour-a-day chemotherapy for about 5 months. It was 5 days in the hospital, 24 hours a day, no sleep, 5 to 6 different kinds of chemo, and then 10 days out. And both I was running the state from the hospital bed and when I came back home, but it really takes a toll on you. And after about the 3rd round, all my hair fell out in the shower one day. So I was like, I didn't want to be laying in the bed in a picture with no hair and have people see that for the first time. So I dragged myself out of bed, went to the office, put on a suit and my shades. And this is my cancer picked the wrong dude. There's that posted this picture here. But throughout the whole thing, I mean, look, I met so many other fellow cancer patients and their families and what they were going through, and it made me a better person and more empathetic. But it was a struggle. I mean, we had a great team. I had the support and love of my wife and my kids and the great medical team, but it was all of you guys kept helping run the state. The lieutenant governor stepped up and our whole team, and I tried my best to keep working.
I want to get to that in terms of managing the state, but Matt, I want to shake things up a little bit. You were the communications director when all of this was going down. And talk to us a little bit about how you advised the governor to communicate. You had done crisis communications professionally, but this was probably a different kind of crisis than you had ever faced before. How did you counsel the governor in terms of that messaging to the public?
I remember the timeline that the governor just went through, and I think we came in. So I think you got the diagnosis on a Friday. We came in on a Saturday morning, so we got called in on a Saturday morning.
I got 15. Yeah.
And it was a relatively small number of us. It was really just the communication staff who got briefed. And I think there were 3 of us who were sitting around talking, or 4 of us who were sitting around talking about it. It was myself, Doug, Russ, and I think another person. And the first thing we did was start to go through what have other elected officials done? What has Senator so-and-so done when when he or she was diagnosed, and how have others handled it? And we debated it, went back and forth between ourselves. And then we ended up walking into the governor's office, and he just said, here's what I'm doing. Like we had spent 2 hours coming up with a plan and some talking points. He's like, here's what I'm doing.
Telling people on Monday.
I'm telling people on Monday we're doing a press conference. So send out the thing for the press conference and help me with talking points, which he didn't even really use the talking point. The reality is, I think we were all really taken aback, right? I'm really anxious about it because
they weren't just anxious about the communications. They were like, oh my God, the governor's going to die of cancer.
Yes, it was everything.
We just got our jobs.
Right. There's no jobs. I have to say, going back to the previous conversation, after seeing the governor in the Freddie Gray riots and doing this impromptu stuff, these ad hoc press conferences day after day, we were nervous, right? And we wanted to try and manage it, right? So the comms people always want to do is try and manage the message. But we also kind of knew in our hearts that he was going to be really good. He's gonna get out there and just be himself and be honest. And that's exactly what you did at the press conference, and told some jokes while you were up there. So.
Yeah, well, so I got up there and I just told him what we were dealing with. There was a lot. Well, first of all, the doctor said, I said, I'm doing a press conference. He said, oh my gosh, no, you can't do that. He goes, there's not going to be questions at this press conference. I was like, I'm pretty sure they're going to ask questions. So it's a packed room, more people than this with cameras everywhere, and a lot of questions. And one of them was like, are you going to resign? What are the odds? And they asked, what are the odds? And I said, well, they're a lot better than the odds of getting a Republican governor elected in Maryland. And then one of them said, well, is there any circumstance where the lieutenant governor would have to take over? And I was like, well, sure, if I die, he's going to be the governor.
If I was dead, I just sort of stared at the camera.
So, but it was a lot of other questions and details, and my family was there, and it was emotional, and it was the first time ever that the entire Washington, Baltimore press crew at the end of the conference, they gave a standing ovation, and they're usually tough critics, but they appreciated the honesty, the right, and they were sincerely concerned about, hoping I was going to make it through.
So, Governor, it was an emotional time for you and your family and for the citizens who had just elected a new governor. Tell us a little bit more about how you functioned and still ran the state, and how you partnered with the lieutenant governor, and your strategy for managing the levers of government while you were getting your treatment.
Well, I had to focus on my health, and it was a pretty serious diagnosis, and the treatment was pretty rough. I mean, it was, I tried to put on a strong face, but it was hard. It was really hard. And don't want to get into all the details of it, but I thought it was, I loved the job, and I was still a brand new governor, only been there 5 months, and I had a lot of things I wanted to get done, and I was just determined to keep going. And so when I was in the hospital, staff was coming in and out. I was reviewing documents, and I actually had like mini cabinet meetings in the doctor's conference room. I was attached to a cord in my chest with all these chemo bags hanging off of a thing. I'd have to roll it around, but I would get out of bed and do laps and meet the patients. And then we were making decisions. They were bringing me huge piles of work, and I was yes, no, who's not. But the lieutenant governor was back in the governor's office trying to help pick up the slack and run the meetings and keep the levers of government going with great leaders like these guys. But yeah, it was. I tried my best to keep going. There was certain times. Here's a funny story. They filled me full of steroids to combat the 6 chemos, so I could never sleep for the whole 5 days. I was wired. It was almost like doing speed or something. And so I would all night long. My brain was like fired up. And I kept firing off messages all night long. Like, I got another idea, and I got another idea. And people would wake up at 6 o'clock in the morning, and they're like, oh my God, the governor's. So they couldn't wait until I got better to come back because their workload would go down.
So speaking of workload, Matt, we talked a little bit about this, but flesh out a little bit more the need to be transparent with the public in terms of counseling the governor about the diagnosis, versus also the need to protect the governor's privacy, and how did you advise him to strike that balance? And then obviously from the governor's perspective.
Yeah, I mean, the governor's instinct,
and I'll speak for himself in a moment, but was to be very transparent, right? To be out there, to let people see what was going on. But we were mindful that you wanted to do that in a I'm not going to say a controlled manner, but in an appropriate manner, right? You do need to balance privacy with transparency. And I will say the balance that was struck, and we heard this over and over again, was one that really connected with people, right? I mean, how many people go through cancer in themselves or someone in their family, right? And know what that's like to experience. And a lot of the credit, I think, that Governor Hogan got was for his choice to not sort of hide it, right? And not be ashamed or afraid of what he was going
I mean, I was looking really terrible and feeling terrible, but I let him see it. I mean, it was pretty rough. People were like, oh my God, I'm talking to you. But yeah, I still did the press conference.
It was, and look, as a communications person, your instinct is to try and suppress that stuff, right? A bad picture. You don't want that. But the reality is it all worked. It all worked to show sort of a humanness. And look, I don't want to get too political, but again, a Republican governor in a state like Maryland, a lot of the accusations are your lack of humanity, right? In the political realm. And Governor Hogan was really the opposite of that. He was extremely human, extremely accessible, and very real, both on camera and in person. And it just came through for a year in a consistent basis. And what was even more remarkable was the number of other patients who wanted to come out and also talk about their time spent with the governor at the University of Maryland.
Yeah, well, when there were no cameras around and I was stuck in the hospital 24 hours, I would literally do laps all around the cancer ward, and I would go down to the pediatric and oncology ward to meet the kids. And it really was it sounds crazy, but it was a great experience for me because I got to become more empathetic. I saw what families go through. They were going through tougher battles than mine, kids that were battling. So it was not just the communications and running the state, but it was a human moment for sure. I met I lost some friends that I met in there that didn't make it like I was able to.
Did the experience change, obviously from a physical perspective, but did it change anything in terms of the way that you dealt with the job or dealt in your life? What changed?
Well, from a physical nature, it was exhausting. And I gained 40, 50 pounds with these drugs that they were, I lost all my hair. I didn't quite look the same. And you do have a thing called chemo fog where your brain is not quite as clear, it's like, it took getting over that. But it also I think made me a better person. I could relate to people and I think I was more empathetic. And I also sort of realized the things that are more important in life. Like the big problems or the crisis or the whatever somebody's yelling about that day didn't bother me as much because I'm like, somebody would call me a name or say something critical. And I'm like, hey, I just battled life-threatening cancer. That doesn't really scare me or bother me. I also, saw what people's struggles went through in the healthcare system and how difficult it was in families. And I made a lot of good friends.
Great. Let's turn it to some student questions. Emma, if you want to get the mic around.
Nobody wants to talk about cancer.
Any questions? Questions from the audience then?
I'm curious. We've seen today that health has become a big question during election season and what that means for politicians. And I'm sure on the communications team, you guys were starting to wonder what that would look like. Was there a moment where you wondered if this would have an impact politically beyond just your personal story?
Well, I mean, from my personal story, I was trying to be as strong as I could, but I mean, there was a chance there that if this cancer had gone into my bone marrow, that it would have been much less likely chance of survival. And I lucked out, but I was worried. I mean, most of the time I'm going to beat this. I'm going to keep working. But there were a couple of moments when the reality hit that, hey, I just won the biggest surprise upset in America. I just, had a huge successful first legislative session with my 70% Democratic legislature. I just, dealt with the riots. And now is this really the way it's going to end, 5 months in when I was planning on but yeah, I think it just, I never thought I thought about on the healthcare coverage that people don't have and how they have to go through something like this. And the costs are just unbelievable. Luckily I had great, state of Maryland healthcare coverage, but I know a lot of people didn't have that benefit. I saw how great the healthcare system was. And Matt is one of the top folks at the University of Maryland medical system that saved my life. And I can say I'm very proud that people in Maryland have some of the best healthcare in America, which is good, but not everybody does. But I think the health question, there were questions about, can you make it and should you still be governor and are you going to be strong enough? But I think we overcame all of those things. They realized I wasn't going to stop.
So you touched upon the empathy that you gathered for other people when you were fighting cancer. I'm sure also you gathered a lot of empathy for yourself and that journey and taking a lot of care for yourself because you got through that. How do you use that empathy that you got from battling cancer for yourself and your everyday life and kind of taking care of yourself when fighting such major issues?
Yeah, I mean, it was both were true. First of all, with the outpouring of prayers from every denomination and every religion all across the state and around the country and the world. I got blessed by the Pope, and I'm a Catholic, but there were people in everywhere praying for my health, and I got so much outpouring of kind of love and support, which is tremendous. I also met all these other folks that didn't have that, and I was doing laps around. I met a guy named Jimmy Myrick, who was a young man with Down syndrome who was very involved in the Special Olympics, and we became buddies. We did laps together. Like first time I walked, he was the next door neighbor, and he yelled out, he's like, "Hey, governor!" They call me the mayor. We developed this bond, and I awarded him the first ever. It was supposed to be the Governor's Courage Award to give the Special Olympics. He was a super plunger at this polar bear plunge. he then sadly passed away, and I spoke at his funeral, and I changed the governor's award to the Jimmy Myrick Jr. Courage Award. But yeah, I mean, I made real connections and with a couple of people, some who, a couple of young kids. I think some of the pictures were in here where I just met these young people. There was a young kid that came up to me at one of the Redskins games. I went to Ravens game with cancer kids, and a kid came up and handed me a little note, and he said, "My mommy helped me write this," and it was like, here's the advice for you when you go through chemo. He goes, "You might not think the doctors are your friend, but they're actually there to help you." He was like, before they give you the pokey, make sure they give you the num cream. I was like, they don't give me num cream. They can keep poking me. And then, he said, find a hugging person. Mine is my mommy. So, but that young man who was 7 years old, battled cancer. There's a picture of me hugging him at a press conference that he just ran up to the thing and hugged me. It wasn't planned, but he beat his cancer, and I was there when he rang the bell. But yeah, I mean, it's just it's not a thing I want to dwell on, but it did make me look at things differently in life and relate to people that Matt mentioned earlier. Almost everyone is touched by a tragedy like this, either themselves or with a spouse or a child or somebody they love. And now I'm in a club that I never wanted to join, but people come up to me and tell me their cancer stories. And now I've also dedicated my life to working on cures for cancer and raising money for cancer awareness because it's really something that touches an awful lot of people.
Okay, Matt, back to you.
We're gonna go to the next topic.
Yeah, so we've started with riots and then on to cancer, and now we go to COVID. I'm sure everyone's looking forward to reliving.
There were other things over the 8 years.
Well, let me ask another
We
question.
accomplished a lot of things. We actually had a lot more crises. We just narrowed it down to these 3 really bad ones.
Let me ask another question before we get into COVID, just briefly. Then, you touched on it, right? So, in the governor's office, there's something every month. There is. I can list them off, right? We had the Capitol Gazette shooting in Annapolis. We've had school shootings. You had, you'd have weather events. I remember shutting down highways because of blizzards, hurricane warnings,
Ransomware
In Ellicott
attacks.
City.
flooding in Ellicott City twice. So you have these big moments like COVID or the riots or whatever else, but they are just a piece, right? How do the big moments sort of help you sort of think about and manage through? I don't want to call them small because they're also big, but the more routine crises that a governor might have to deal with.
Well, that's a really good question. Some of the things we talked about earlier, I do think the key to success is surrounding yourself with the right people. And I knew I wasn't the smartest guy, and I really didn't have, other than running a small business, had no real leadership experience. I never dealt with a crisis like that. I didn't have to worry about people's lives being in danger. But I trusted the team around me. And I think those crises, which were like, oh my gosh, we have to deal with these things, it helped us become a better team. And it helped me become a better decision maker. So even on the smaller crises or the day-to-day decisions, I trusted the input of the team. They felt comfortable giving contrary opinions. And I got pretty good at decisively making decisions. And while we were pretty good at communications, I didn't say, how's this going to play? Or is this politically? It was like this, give me the information and I'll make a decision. And I wasn't afraid of making decisions. I made some tougher ones before. So the little ones seemed kind of easy.
We'll get to COVID, but I guess if I can make an observation, and you and I haven't talked about this, sir, but I thought it was remarkable when the new governor, the new administration came into Maryland. Any administration changes their cabinet, they switch everybody out, which is certainly the right thing to do. But one of the holdovers was your emergency manager, right? And that was, I think, a sort of a remarkable and important choice that the new administration did. And I think based on some pretty strong advice that you gave the incoming administration. Am I right about that?
Yeah, I mean, look, when I was term limited and couldn't serve as governor anymore, Wes Moore was elected as the governor. I went out of my way to be, our entire administration worked for months. The Lieutenant Governor Boyd Rutherford headed up our outgoing transition team, provided all the help. But I had a number of long talks with the incoming governor, giving him advice. And I think they appreciated how we dealt with emergencies and crises. And I told them there are a lot of things that keep you awake at night. And here's, my suggestion is your security team better be ready. Like luckily we had the right emergency management team. We had the right state police team, the right people at the National Guard. Otherwise, none of these positive stories would have been positive. So I think he listened to that advice, and we did have a good team, and he was non-political. He was just a guy that knows how to run things in a crisis. And they kept a few of our people around, which, I mean, obviously they're going a different direction, had their own team, but I think it was a reflection on, hey, these guys were pretty good.
Matt, before we go on, Amelia's not here, so we can be unscripted. Now, normally we'd have to be much more
Yeah.
scripted.
Amelia would keep
The
us.
enforcer really is Amelia Chasse Alcivar, who's stuck on the train. These guys cower when she tells them what to do. We had a lot of strong women in our administration, but they're not here today. Except for Tiffany, she's the strong one in the family. She's gonna rat you out.
One of the consistent yet simple themes about a lot of these, I think, is kind of a truism. You showed up in so many of these things in terms of, I'll think back to not that long after the Parkland school shooting, we had a very crisis situation in St. Mary's County, and you showed up. In Baltimore, you showed up. And Matt, I'd be interested in your thoughts on this as well. It seems like that went so far to reassure people is your presence when these things occurred.
Well, that's a good point. Look, the reason I was successful in the bluest state in America as a candidate in 2014 is I went to places that Republicans don't normally go, and I showed up even before I was governor. I showed up when it wasn't a crisis. I went everywhere and listened to everyone. And I think people appreciate it. But when there's a crisis and people are focused on it and they're hurting and there's real actions that have to be taken and there's real emotions that people are suffering in that community, I think it just matters to them that you show up. I was there at every shooting. I was there instantly after the Capitol Gazette shooting. I was there instantly, in St. Mary's County when we had a school shooting. I was there every time a police officer or firefighter died. I was at every funeral. I mean, it's part of the job to, I said earlier, to be the consoler in chief and to show up and let people know that you care and that things are going to be okay and that you're going to be there for them. In addition to all the actions that you have to take, I think if you're not there, they don't get the fact that you care.
I just want to add to what Governor Hogan's saying. We showed up, but rarely did he talk to press when we got there.
Yeah.
It was the emergency responders. It was the people who were affected. It was not, we weren't there for the cameras. We weren't there for the reporters. We would talk to them. We would engage with them, but that was always an afterthought in those.
Well, a perfect example, and we mentioned it earlier, when the riots first broke out, the very first place I went was to shock trauma with 127 injured firefighters and police officers. And I shook every single hand. I then thanked the doctors and the nurses, and no one knew we were there. We never had it. We didn't have a camera. We didn't take a cell phone picture. We never told anyone until years later, I don't think, after I wrote a book about the experience. But we weren't there to get attention. We were there to console the people and to thank them.
I guess we'll go on to COVID, Chris.
COVID. Yep.
So
Happy topics. COVID.
A happy crisis. We don't have too many happy crises.
That's not.
So, Maryland is credited with some of the best outcomes when it comes to COVID in terms of fatalities and really just by any measure, economic performance, however you want to look at it. So the question is at the very highest level, and we're going to dig into this a little bit, but what were the kinds of things you were thinking about when you were trying to make some of the tough decisions you had to make over a period of 2 years that you were dealing with the crisis?
I mean, it was an incredible challenge, the worst pandemic in more than 100 years, and no one was prepared, and no one, had any idea the kinds of difficult decisions. We literally had to make hundreds and hundreds of decisions, and none of the answers were good. It was like this: you do this, and it's going to be bad, or if you do this, it's going to be bad. But somebody had to make those decisions and take those actions, and they might be popular or unpopular. But it was, as we were having this discussion today, I mean, in one instance, I was trying to keep the people of Baltimore safe because there was violence. In the other instance, I was, my life might have been in danger, but it was just me. I had to worry about myself and how do we keep the state going. In COVID, I really literally every day, I'm laying awake at night thinking about the lives of everybody in Maryland and how many people were going to die and how many lives we could save and how much we could prevent. And so that was an enormous, burden, but it was, I think the number one job for a governor or executive is the safety of their citizens they represent. And this one, everyone was in danger. And so it was much more difficult. It was a huge undertaking. When this thing, I don't know what the other questions are. I don't want to talk too long on one answer, but it was, we had to make very tough decisions. I think we led the nation. Multiple people said we had the number one response in America. While we had people arguing back and forth about different decisions, at the end of it, 76% of the people in Maryland approved of the job that we did. I think we were number one in the country by a number of different organizations. But I wasn't saying, how do we be popular? I was just, again, I got the best input from the smartest people, from the epidemiologists and the virologists and the public health doctors and universities and the University of Maryland medical team and Hopkins and from the business community and other leaders about how's this going to impact jobs and how do we come up with keeping people safe and save lives and livelihoods. But I was governing not only my state, but I was leading the whole governors association at the time. As governor stepped up on the front line, so I had quite a bit of responsibility during that, and we I think tried to help make the best decisions we could.
So that's actually the next question. And I think Tiffany is here from the NGA and
She was part of our team before she went to the NGA.
So you have just become the chairman of the National Governors Association, and much like in past instance, right away you were tested with a crisis. Talk a little bit about how you worked with the National Governors Association and the governors at a very tense time between states and the federal government. How did you manage that?
Yeah, well, to go back to the beginning of that, because interesting story. I was actually halfway through my first year as chairman of the National Governors Association. You pick a chair's initiative. Mine was rebuilding America's infrastructure, which I think we did a great job on. We got all 50 governors to agree on a set of recommendations, which became the basis of the bipartisan infrastructure bill that passed. So that's what I was focused on before this crisis hit. And then that really became a defining moment as the governors really were on the front lines in a thing where nobody was prepared or ready, and federal government in some cases was not responding, as well as they could have or should have. The messaging was all over the place. People were scared, but the beginning of it was we were paying attention in early January to what was happening in Asia. I was paying attention. Our team had some discussions, but we didn't realize it was so bad. Nobody was even paying any attention. The first week in February, we have an annual conference in Washington, National Governors Association, with all the governors, usually all 50 governors or 54 governors with the territories are, there. And we have a White House dinner, with all the governors and their spouses, with president, vice president. And we have a packed agenda, but right before this thing, like the week before, some of you may remember back to the beginning of the crisis, it hit the state of Washington, and they were taking gurneys with dead bodies out of this nursing home. And then there was a cruise ship off the coast that couldn't dock because of this disease had spread. So it was early on, but still no one was paying much attention. I asked to put together on the agenda an emergency meeting and called together the top federal government experts on this thing. It was Francis Collins, head of NIH. It was Bob Redfield, the head of the CDC. It was Stephen Hahn, I think, from FDA, and we had Anthony Fauci and a guy named Robert Cadlick. There were 5 top experts in the country. We called in to meet with the governors in a private meeting right before the White House dinner. And these guys told us, in very unfiltered and things that had not been discussed publicly, that no one was prepared for. Things like, millions of people could die. We could be quarantining entire cities. We could be shutting airports and the borders. And there's governors sitting around a table with eyes like this big. And then we went to we were actually, a lot of us were late for the White House dinner because we had to go change into tuxedos, but we kept this meeting going longer to talk about COVID. But people were just shocked. So flash forward a month later, we went back and immediately started launching everything, COVID crisis, emergency team, bringing in experts, getting ready. Federal government, I'm not sure exactly what actions they were taking at that time, but then I think at the beginning of March, I got a call from Mike Pence asking me if I would come to the Situation Room in the White House. He had just been named the coronavirus task force chairman. Would I gather all the governors on a Zoom? We couldn't get all 50 governors in the Situation Room, but I was there. It was Mike Pence. It was the first day that Deborah Birx joined us, the kind of one of the leaders, Dr. Deborah Birx, Fauci, Redfield, head of HHS, Surgeon General, a team sitting around. Pence ran the meeting, and we had all the governors up on a screen, and that was the first real ever time that that's never happened. I don't think all the governors had never had an emergency meeting with the White House. That was the beginning of what I think turned out to be 50 some Zooms and meetings that I led with all of the nation's governors, with all of the federal government's leaders. Usually governors, we see each other at conferences 3-4 times a year. We might talk on the phone about a particular thing in our region or some problem, but we met every week, sometimes repeatedly, sometimes in meetings with just the governors, sometimes with all of the folks at the federal level. And I was leading those meetings and starting out, Mr. President, here's what we need. We don't have any test kits, or, we need the National Guard support, and we need this, or we need that. And there was a lot of tension back and forth. And so the governors were leading during a crisis. They all led in different ways, but we worked together. I'm very proud of the National Governors Association, and all the governors really, we all stepped up. We were constantly calling each other in smaller groups, like, how are you dealing with this? And what about that problem? But I was the guy had to call Mike Pence and say, that press conference the president just had was not very helpful, when he said this or that, or we need this, and no more fooling around. Like, the president went out and has said, anybody that wants a test can get a test. And I went on TV and said, nobody in America has a test. No governor has any. That's not true. So it was a contentious time, but I think never before have the state leaders taken charge of a crisis situation. And we later got better cooperation and with the federal government, and Operation Warp Speed, coming up with the vaccines years ahead of schedule. There were some real successes, but there were a lot of stumbles. And it was leading into crisis. I was worried about my state, 6.5 million people whose lives were in danger. We had to build entire infrastructures from scratch. We had to find PPE and masks, and we had to build an infrastructure to vaccinate 6 million people. And all that was hard. It was also hard, like fighting back and forth with the federal government and all the other states for very limited supplies of things that we desperately needed, and searching the world. It was a crazy time, but another leading in the crisis moment.
So, Governor, by the time COVID had come around, I had been demoted to Chief of Staff.
He was the communications director, which he thought was really important. And then I gave him this other terrible job of Chief of Staff, where he had to run a $50 billion operation with 90,000 employees. I remember the early days of COVID, and it was pretty wild. There was some just a lot of craziness and a lot of uncertainty. But I also remember there was a couple of sort of simple lenses, right, that we would look through when we made decisions. And I remember those first couple of weeks, we would try and decide, do we order these respirators, right? Do we order these masks? Do we spend the money on this? Do we spend the money on that? Do we issue an executive order that's never been issued before, right? Groundbreaking policy and groundbreaking use of executive authority. And you would repeatedly say, is it going to save lives or is it not? Right. And that was a really, really simple lens to make decisions. Can you talk a little bit about what it felt like, really, those first 2 or 3 weeks, and then how your decision making might have evolved as time went on and you started to get better information? Well, yeah, again, the information was really scary, but it also wasn't accurate. So we were trying to decipher and figure out. We didn't have real data to go. No, it had never happened before. Nobody had ever dealt with it before. So when that first meeting, when the federal leaders were telling us millions of Americans are going to die and you're going to have to shut down cities and airports, that was scary. Then we had Johns Hopkins University, which is obviously just a competitor of Matt's University of Maryland, but pretty good. They told me in March at the beginning that by June 1st we would have 30,000 dead Marylanders. I mean, luckily that didn't happen, but that was how we were making decisions, based on how it was a scary time. So we were making, again, get the information, make rapid decisions, don't care about whether what the politics of it or the communicate, as long as we made decisions that were going to save lives and livelihoods, and then communicate to people very clearly, this is what we're doing, here's why. And I think we got marks for the first, 30 some days. We had press conferences every single day, not because I wanted to talk to the media every single day, but because people needed the information, they were scared. They didn't know what was happening. And we were making we made hundreds of decisions. I mean, it's crazy the things and every one of them was really hard and they had to be done instantly. I mean, we did end up losing nearly 15,000 Marylanders. We had 53,000 people hospitalized. We ended up building 6,000 additional surge capacity hospital beds. We had to build an entire testing infrastructure to do millions and millions of tests, and vaccine infrastructure to vaccinate millions. I don't know how many. We had 76% vaccination rate, one of the highest in the country, but it was millions and millions of people. It was all tough, but the communication, decision making it was around the clock, 24 hours a day, weekends, nights. It was way more than going through cancer. It was way more than dealing with a week of riots. It was 2 years of over and over again, every day people are going to die if we don't do something. And then decisions we might hurt businesses and jobs and kids in school. And it was like a major, you're talking about the snowstorms and floods and fires, and those things happen in like one part of the country one day, or a tornado comes through. This was every single day. It never stopped for like 2 years. That's what it was like, and it was happening everywhere in the world.
So I'm gonna ask one more question, Chris, and then I give it back to you. So we've talked a lot about your capacity to connect with people, and I think in many ways that defined your a lot of your governorship. You're always out in communities.
That's my favorite part of the job, actually.
So how hard was that during COVID for you? Because your superpower is now you got kryptonite, right? You can't leave your office. You got to spend time with guys like Chris. And
That was hard.
And did it change the way you led? Did it change the way you thought about communications?
That's a really good question. So I'm a people person. I think, people ask me, how as a Republican do you have, all the Democrats vote for you in Maryland. I think part of it was because people say to me, you seem like a regular guy, you seem down to earth. What you see is what you get. And I love being with people. That's my favorite part of the job. And I'm a hugger. I'm a guy who goes out and chugs beers at the Orioles games with people. And I'm, hugging people whose places were burned out in riots. And I thrive on that. I love people. And it was really hard. It was when I had a cancer of the immune system and they told me I couldn't shake hands. That was really, really hard so that was a little lead up to COVID. It was like, I remember I was at an Orioles game and Adam Jones it was a big home run hitter for the Orioles, ran into the dugout and came out with some batting gloves and he gave them to me. He said, "Governor, now you can shake hands," which was because I was like, all day long, I was like, "I'm sorry, I can't shake your hand. I can't shake your hand." And that was like years before COVID. But then COVID, it was like, we got to socially distance. We got to wear masks. We're not supposed to go outside. It was like, so I was like, oh no, not this again. But everybody was doing it instead of just me. We were sort of trapped. It was like we were working like crazy, but just like everybody else, nobody else. We shut nobody was working, and nobody was in their offices. We were in office every day because we had to, and we had small teams of people, and we let a lot of people not come in, but there was a small group of us that we were together, but we saw way too much of each other, and we didn't see other real people. So it was hard. But we kept communicating across the TV, and people say to me to this day, "Thank you. You're the only one that we listened to." We never got good information. It wasn't coming out of the federal government. It wasn't coming out of the White House. And they were like, I only tuned into people from other states told me they watched our press conferences, like on YouTube or on Facebook or something, because they thought we had the best information, which is, so we were communicating. We just weren't able to get the in-person touch.
So Governor, on that last point, I think I'd like to flesh it out a little bit more, because I think Matt talks about your superpowers. I think one of your superpowers was the ability to distill complex information of which there was not a whole lot of clarity out there, and be able to take that information and then process it, understand it yourself, and then communicate it to the public in a simple way. And we watched you do that. And I took a little break from the state for a while. I remember being in our family room with our family, watching you tell us how these things were operating. How are you able to develop that level of communications strategy to distill this complex information down where people could understand it?
I don't know if it was a strategy, but I think it is a skill that I have, and it just comes naturally. I mean, I started when I was running for governor. I was in a group called the Maryland Public Policy Institute, and we would put out these really detailed papers about how we're going to be more competitive and how we're going to distill all this the economic information. No one listened, but I would just go out and make it simple. And I talk, kind of a regular guy kind of talk, and I would just cut through that stuff. So when things like COVID or whatever, I just went out and told people. I did gather all the information. I'm not the smartest guy, but I listen to smart people. And then I'm pretty good at distilling very complex things into simple. Like, for example, during COVID, I was like, just wear the damn mask. I said at a press conference. Well, you could get in a long discussion, but that people are like, okay, I'm going to do it. It's like, I think it's communicating the way the average person wants to get the information. They don't have time to get all the details. They just want succinct, direct, honest communications. And so distilling big, complicated things into simple things is, I think, something I'm pretty good at.
So Matt, let's turn to you on the communication strategy. Your day job is to run and manage state government and respond to this crisis, but you're also a communicator. You now have a boss that needs to communicate vastly more information more frequently than in the past.
And more scary information.
Scary. How do you pull all of that together to make sure that you're moving at a pace that you've never operated at before? How do you pull all that together?
So thanks for the question. The first few weeks, as the governor said, were just all over the place, and we were just flying by the seat of our pants. You're making a decision hour by hour. But as the crisis really set in, right, just like everybody else in the country, just like ordinary people, it started to just become part of life. And one of the things the governor quickly pivoted to, and the communications followed, were some planning. Right, once you sort of get your arms around that this is life for a while, we began to start to engage in some strategic planning, and that leads to communications planning, right? So you begin to think about what are the decisions you're going to make next week, what are the decisions you're going to make the week after that, what information does the administration need, and that is really driven. All of that, I think, was driven by the governor's desire to keep that information flow going, keep that decision making machine working, and not let state government be paralyzed by.
Well, we tried to catch up. We were digging in the sand, and it kept getting worse. But we were like, we tried to look ahead to what's the next thing, next week and next month, and how do we get out of this, and then what's the next. We were tracking the data every day and all this input. But I actually also sort of transferred over a lot of the responsibilities of the day-to-day, kind of making the trains run part of state government to the lieutenant governor, so I could focus like a laser beam on the COVID crisis with our other team. So it was a babe. So like, okay, these things I used to pay attention to, but I trust you can handle that. We're going to go try to, keep people alive and fight this virus.
Great. Questions? Students?
Yeah. Emma? Yeah, Mike. No, he's pretty close. I could probably hear. But go ahead. Yeah.
So a lot of the crises you've dealt with, be it personal or executive, interact with the healthcare system. And I was wondering what your perspective what sort of perspective you gain dealing with these various crises, be it COVID or cancer, about inequity in healthcare. So these are sort of crises that may not be headline grabbers, but are sort of slow rolling problems, whether it be sort of like the ability to pay for things like cancer treatment, or sort of a more preventative care perspective of like an energy policy, transportation policy, food policy. I just love to hear about your thoughts on that and what you've learned over your course.
Well, great question. Well, obviously that was a huge part of COVID because every single person was involved. There were tremendous disparities, and I think we started the first effort in America to really go after disadvantaged communities and to make sure that we got it into places that was difficult to get in, people that didn't have healthcare. We have the equity task force. We had the National Guard headed up to make sure we got vaccines out everywhere in every community. Obviously, the healthcare system jumped in with people that didn't have any healthcare medical coverage. Were all given treatment throughout COVID. The things we stood up were incredible. We built an entire new healthcare system in a matter of weeks and months. Never been done before. University of Maryland was a tremendous part of that. I mentioned earlier when I was going through cancer, I did come in touch with a lot of people that didn't have the same ability to get healthcare. Well, we by the way, going back, he's looking at his watch because I got to shorten it up. But on the disparities in healthcare, I like when the Republicans were trying to throw out Obamacare with no replacement, I stood up. I expanded coverage to cover more people. And then I got together with the Democrats in the legislature and passed legislation that lowered the cost of healthcare by 30% for everybody in Maryland, which is a very difficult thing, and then covered all the people that didn't have coverage. So it was a big issue. I'm sure that all of those, I mean, the riots, I said, I went, you know, it was people were injured in the hospital and they were taking care of everybody. It didn't matter whether they had health, you know, I don't think health insurance or not, they're saving lives. But COVID, I think the healthcare system did an amazing job. We did work very hard on trying to fix the access to healthcare for people. We have one of the best in the country, and we covered more hundreds of thousands of more people, and we lowered the cost for everyone.
Hi. So one of the things that you've stressed a lot today is how important it was for you to go into places and meet your constituents, right? To meet people and talk to them one-on-one, and how that was a major part of your dealing with any kind of crisis. Why is that so
Even when there
important?
wasn't a crisis.
Yeah. Why is that important in a crisis though? And also outside of it, I guess.
Yeah. Oh, by the way, I just noticed, I don't know how she snuck in, but the woman who I said was going to be the star of the show, Amelia Chasse Alcivar, just came into the back of the room, and I think it's too late now, but made it on the train. You know what I'm going to do? Because she stood us up, and Chris did an amazing job of filling in, but I think I'm going to make her do my next seminar. She's already said yes. So, but yeah, I think it's all, I thought it's important. It helped me get elected governor. It helped me understand people better. I was never afraid to go anywhere and talk to anyone, which is why I think I convinced, you know, I left with a 80% approval among Black voters. You know, that doesn't usually happen for Republicans because they knew I cared. I kept showing up over and over again when there's no crisis and there's no cameras, just walking the neighborhoods and listening to concerns and trying to address problems. But in a crisis, it's important to be there and show up because there's the individual people that I was hugging or helping sweep out the glass from their small business or walking the neighborhoods. Those people, I think it meant something to them that I was there, but it also showed the broader community, like, hey, maybe things are going to be okay. Somebody's actually paying attention and listening, and they care. And even though it's kind of messed up right now, we're very concerned about COVID, or we're very concerned about the crisis with, you know, the riots in Baltimore, or whatever terrible flooding, or, you know, whatever the issue is. I think in a crisis, people need to know that, you know, someone is there, and there is a consoler in chief matters when there's, you know, I was there right after this shooting at the Capital Gazette newspaper. We had journalists that were killed with a mass shooting. I was there when we lost a student in Southern Maryland. I mean, it matters to the families and to the coworkers and to the other students and the people in the community. If you don't show up, it kind of sends a really bad message that you don't care.
Hi, you talked earlier about like staff relationships. And so I was just wondering, during the COVID crisis, did the Trump administration and federal government at that time contribute to divisions? And like, how did you work with that and work to unify?
Yeah, well, there are a lot of layers to that one. On the staff level, we actually, with the governor, so all these meetings we had constantly with the federal government, they were pretty responsive and they communicated with the governors. Like some of the people I mentioned, the health leaders and the various agencies, they didn't really contribute to a lot of division. There was terrible messaging coming, I think, out from the White House and from the president that was not that helpful. And I would push back pretty strongly, both either to the vice president in a phone call or directly to the president in front of the other, 50 governors, which he didn't like much. I told them, these are the problems. This is where they failed. This is what's not true. This is what we desperately need. But I also, would compliment them when they did do something right. So there's a quick story. I led all these Zooms. The president, Trump is on there, the vice president, all these guys. We have 50 governors on a screen. Trump does not like me pushing back. He does not like me telling him what we don't have or what we need. He did not like me being somewhat critical sometimes, but that was, I thought, my job, and I thought it was important. So this one time I start out the meeting with all the governors and I say, Mr. President, first of all, I want to thank you for your team. Your cabinet has been, the communications with the governors has been really good. And I want to congratulate you on the success of Operation Warp Speed, which was that they had just discovered the vaccines that were going to save people's lives. And Trump leaned back in his chair, like he was like this in front of all the other guys. He's like, oh, so now you're being nice to me. I was like, what do you mean, Mr. President? I'm always nice. And all the governors laughed, but he didn't take to input or criticism. And, I think had he handled that crisis better, he probably would have continued to be president. I mean, the economy was pretty good, but the way he handled that, I think, was his downfall. And I think he made terrible mistakes throughout. There were successes. He had a good team. They discovered the vaccines. We ended the crisis, but the messaging was terrible. And I tried to point that out as much as I could.
I think we have time for one more question.
Hi, one more question. So you talked a lot about taking information and making it clear and combating a lot of the disinformation that was going on
Yeah.
at that time. And as we all know, there were certain states and other governors who didn't handle the situation quite the same way. So what was it like differing from and taking a different approach from some people in your party and from some of your colleagues? And like, did that impact any of your relationships with some of your colleagues and with your constituents who didn't agree with the approach?
Well, it's a really good question, and it was hard. I had to stand up and disagree with people in my party and people in my state that thought it was, they didn't believe in vaccines and they didn't think it was a real, virus, and it was like, they weren't taking it seriously. There were people all across the spectrum. So I talked with a lot of governors. I was running the governors, but also was having conversation with Democratic governors, Republican governors about like a lot of discussion with governors because we were all like on our own basically. And we were trying to share best practices and information. And so I was the chairman of the national governors, which is all the governors. I was also on the executive committee of the Republican Governors Association. We have different conversation with different groups. And I was probably in disagreement with some of the folks, but there was I shared information that I think was helpful to some of them who weren't getting the same kind of input and expert advice. That we surprised them with some of the things that we brought to their attention. And look, I think some people kind of maybe took actions that really hurt, that went too far in one direction. There's other people that didn't really do enough and people died because of the lack of action. I think we got it right, but I think overall, governors stepped up and led. They had to make decisions they never had to make before, partly because the federal government didn't. But at the beginning, all the advice was the same. Like the Trump administration was saying, shut down everything. And then when the governors did follow his advice, then he yelled at them all and said, why are you shut down or locked down or whatever. He was like, the message evolved. Republican governors sometimes took really quick action at first, including some of the ones, I don't want to name names, but there are people that go around bragging about how they didn't do anything. They shut down everything. They took dramatic actions right away, and then they reversed when the public opinion changed. But there was tremendous disinformation. I mean, and it cost lives. There were people that actually really believed that the COVID was fake, that no one died, that the vaccines were killing people. I mean, we lost 1 million Americans. It was a serious crisis. We lost more people in COVID than all the wars added together, since the Revolutionary War.
Ava, I'm going to turn to you now. I think we've reached the end, and Ava Gadon from the Sine Institute is going to wish us some closing remarks.
Thank you everyone so much for joining us today. And thank you so much to our 3 incredible speakers. We could get a round of applause for them. So wonderful having you join us here today and for your past seminar. And I know we're all, including everyone I'm making eye contact with right now, are really looking forward to the next seminar as well, which will be on March 20th after spring break. We'll meet right back here in this room at 2 o'clock. I hope to see you all there. You can find registration on our website. If you're looking for any more information, we have postcards out front, and grab a sticker and put it on everything you own. Thank you so much for joining us today again.
Thank you all very much.